Hello and welcome to today's session to help your organization prepare for NCVHS review of proposed and updated operating rules for federal adoption. My name is Erin Weber and I'm the Vice President of CAQH CORE. During today's session, I'll briefly review CAQH CORE's mission and vision, the federal update process for operating rules, and then I'll turn it over to my colleague, Bob Bowman, Principal of Interoperability and Standards at CAQH, to walk through the requirements included in the proposed operating rules. Then we'll talk about next steps and how to prepare your own comment letters and testimony on the proposed operating rules. Very briefly, CAQH CORE is a collaboration of providers, plans, vendors, government entities, healthcare associations that come together to develop operating rules or business rules that support the electronic exchange of information. We support the development of the operating rules through our more than 100 core participating organizations. We drive adoption through our certification program and ROI measurement, and we support industry education on all topics related to interoperability. Today, we're going to very specifically focus on operating rules and those that are federally mandated. CAQH CORE is the designated operating rule authoring entity under HIPAA by HHS. To date, 3 sets of the core operating rules have been federally mandated for eligibility and benefits, claim status, and payment and remittance transactions. You can see based on this table, each set of core operating rules includes infrastructure and connectivity requirements, and some transactions also include data content and other requirements. That'll be important as we talk about our proposal to update some of these existing federally mandated operating rules. To understand the path to federal mandate, there is an entire process that CAQH CORE must follow as the designated operating rule authoring entity. CAQH CORE has an operating rule development process that is consensus driven and involves multiple levels of voting, approval, and quorum level requirements across our core participating organizations. Once rules have been fully vetted and approved by the core participating organizations, they are then reviewed by the CAQH CORE board, which is multi-stakeholder, and approved for voluntary industry adoption. The CORE board then considers if there are any operating rules that they would like to move forward for federal adoption under HIPAA. Once the CORE board identifies a set of rules for adoption under HIPAA, the first step is to inform the National Committee on Vital and Health Statistics of their recommendation. So this is the process we're in the midst of right now. Back in February of this year, the board voted to move a set of operating rules forward for federal adoption. So in May of 2022, they sent a formal letter to the NCVHS committee recommending a set of rules for federal adoption. Links to all of these documents are available through the PowerPoint and on our website. Once NCVHS receives a letter requesting formal review of a set of operating rules for federal adoption, that triggers their own process, which includes soliciting industry feedback on the proposal. So NCVHS has scheduled a hearing to review the proposed operating rules on January 18th and 19th in 2023. They have also put out a request for comment where any industry organization can submit written comments to them by December 15th, 2022. Once NCVHS receives all the feedback from industry stakeholders through the comment period and the hearing, they will then draft a letter to the Secretary of HHS, including a recommendation regarding whether or not they believe the operating rules should be mandated. Once CMS receives that recommendation, if it is to move forward with any federal mandates, the formal federal rulemaking process begins, and HHS would issue an interim final rule, as they have done with past operating rules, with a comment period and ultimately adoption of the rules. Typically, industry is given 25 months to implement and adopt new rules. I think I speak on behalf of the CORE board when I say we are really excited and optimistic about the set of operating rules that the board has proposed for federal adoption. Bob will walk through the details, but I want to highlight the importance of these operating rules. First is that these rules, several of them are updates of existing federally mandated rules. The CORE participants have reviewed these rules and identified unmet market needs that need to be addressed for current business practices. Many of the federally mandated rules were developed 10 or more years ago, and our industry has changed and evolved both from it has become more complicated, security is more important, and these rules modernize that and address key things like telehealth and the need to understand prior authorization, the complexity of benefit plans. So the first set of updates really updates some of these outdated federally mandated operating rule requirements to align with current and emerging business practices. The second key thing about these rules is they really facilitate the alignment of administrative and clinical activities. And I'm really speaking here around the proposed new attachments operating rules, which really support claim submission and prior authorization requests by moving our industry towards electronic exchange of additional documentation. These operating rules support multiple standards, and that's really the third point here. Our industry is rapidly changing. We are identifying new ways to exchange data, but as we do that, we want to ensure consistent rules of the road and expectations for senders and receivers of this information. So some of these rules, such as the new attachment operating rules and the connectivity rules, apply to the HIPAA mandated transactions as required under HIPAA to be federally mandated, but they can also be used with other standards such as CCDA, FHIR, PDF. And so we're really excited about the flexibility that is incorporated into these new and updated operating rules to meet today's and tomorrow's business needs. So now I'll turn it over to Bob Bowman to walk through the details of the rule packages. Bob?
Great, thanks, Erin. And as Erin mentioned, we do want to provide an update on both the updated rules as well as our new rule set. The new rules will be included for attachments. The existing rules that we have for update include our connectivity rule, which we'll go over first. The vision for the CAQH CORE connectivity rule is to really establish a national base for the data exchange of administrative information. And this ensures that both the connectivity and security requirements are fixed between trading partners. They know what to expect when they exchange the information. The update to the latest version includes the requirements related to REST and other API technologies, but really ensuring that it supports the framework proposed by CMS and ONC's interoperability rules. As always, the rule includes safe harbor requirements, continuing the support for SOAP, but as I mentioned, also ensuring that REST, a more contemporary exchange model, can be used as well. Again, the rule update includes all particular transactions that are found within the CORE operating rules. So this new version of CORE connectivity can support all data exchange related to the administrative or HIPAA mandated transactions. Again, as always, the CORE operating rules establishes a floor, not a ceiling, for the connectivity communication for the industry. On the next slide, you'll see that the CORE connectivity does have very specific scope. So if you're exchanging X12 transactions or non-X12 transactions, you'll find requirements to help support the exchange of that information. We also include specific requirements for standards, security, message protocols, APIs, metadata requirements, message interactions, error handling, and as always, again, the safe harbor requirements for SOAP and REST. These types of requirements ensure that the exchange of data is safe, secure, and ensures that trading partners know exactly what they need to do and expect from each other as they set up these types of connections. We've also updated our infrastructure rule requirements. What do we mean by infrastructure? For us, infrastructure includes all the rules and expectations between trading partners. So how should the system work? How do you plug in and exchange the information? This includes requirements for processing modes, response times, system availability, connectivity, acknowledgements, and campaigning guides. So all of those types of requirements really lay those foundations of those roles and responsibilities between trading partners. You can see that with the updates that we've made, moving from an 86% per calendar week to a 90% per calendar week, including time or additional hours for quarterly system availability for big system turns that we have in the industry, to the more recent version of our core connectivity requirements and companion guide updates. These types of requirement updates that we've made for eligibility, claim status, and remittance advice ensure that the industry can move towards that 24/7 business model, and that the infrastructure supports that model as well. We've also made updates to our eligibility and benefit rule set. Eligibility and benefit transaction is where a provider inquiries a health plan about the specific information about a member, what their benefits are. This includes information related to the patient financials that are related to that benefit, what services are covered in that benefit, and we have made a number of updates to support the exchange of this additional information to the latest benefit and eligibility and benefit rule set. On the next slide, you'll see that there are potentially the first three related to our update includes telemedicine. This is the place of service codes that are included to support the telemedicine requirements related to those benefits. Do these specific benefits have different payment models related to how that particular service is rendered to a patient, whether in the office or if the patient is at home, or if the patient is communicating with the provider in some other way. We have also made updates to support the procedure code. So a HCPC or a CPT code can be submitted in the eligibility inquiry, and a health plan can respond to the specific benefits related to that procedure code. Again, these are related to categories of service for physical therapy, occupational therapy, surgery, and imaging. We've also included new discretionary STC codes and some mandatory STC codes, so increasing our number of total codes supported to 178 codes that can be submitted in the inquiry and response transactions. This allows those specialty providers to receive that specific information. We've also updated our prior authorization and certification requirements for the eligibility transaction. So if a particular service or procedure code requires a prior authorization or certification, the provider will know that at the time of the eligibility transaction. We've also included requirements for the health plan to return maximum benefit limitations and the remaining benefits for a particular member or for that particular service. Again, this is important to ensure that the providers have the information that they need when the member is still in the office. So for example, physical therapy, you may have 10 visits on your benefit, and how many do you have left? So the provider can actually schedule the remaining number of visits to ensure that you have the complete package. We've also updated our tier benefits. The tier benefits includes the coverage status, patient financial responsibility, remaining benefit coverage, authorization certification status, and in and out of network determination for those various tiered benefits. Again, this allows the provider to know exactly how the member is set up within the system and how the provider's contracting is set up within the system too, so they can ensure that the patient financials are properly monitored. Again, the proposal for the CAQH CORE eligibility benefits single patient attribution rule is also part of the package that we've sent to NCVHS for consideration. Moving into our new rules, it includes the attachment operating rules. What do we mean by attachments? Attachments are or refer to the medical information or supplemental documentation required for the administrative healthcare transactions, right? These are the extra pieces of data from the medical record often that supports the claim or the prior authorization requests. Today, much of the exchange of this information is manual. Providers are required to submit through mail, through fax, through email, or through a web portal the various different types of attachments. So it could be a 277CA, it could be a PDF, it could be a CCDA, it could be a variety of different types of documentation that's required for the provider to submit to support the PA or the claim. We have established a number of infrastructure requirements. Many of these will look familiar because these are similar to the ones we've had in every other type of transaction that we've supported. We have some that are shared between both an X12 and a non-X12 method. These include system availability, connectivity, file size, and electronic policy access requirement. These requirements are uniform across both methods. They ensure that, again, the trading partners understand when the system is up, how to connect and transmit the data, what size of the file can be supported at a minimum, and then the access policy ensures that providers know where to go to understand what the requirements are for the attachments. We have the extended requirements for X12 here as well for processing mode and response times, acknowledgements and error code reporting, as well as companion guides. Additionally, for the new requirements, we also have some reassociation requirements. Since the submission of a PA and a claim with its associated attachment is often bifurcated, meaning that they come from different systems through different vendors at different times, the provider and the health plan have to be able to reassociate those two different types of transactions. So we have requirements for providers to ensure consistency, not only with the submission method, but also to ensure that the health plan can reassociate the data as it comes in through those different modes and methods. There are certain sets of data elements, one set for PA, one set for claims, to ensure that the data can be reassociated. There's also some requirements for coding to ensure that the X12 transactions allow for this coding to be embedded within the transactions to help support that reassociation. We've also had some recommendations for using LOINC codes to ensure that the transactions and the attachments related to those transactions can be supported as well. So that was our quick overview of the requirements. I'll hand it back over to Erin for your next steps. Erin?
Thanks, Bob. So Bob has shared with you a high-level overview of all of the requirements included in the proposed new and updated operating rules for federal mandate. I would encourage you to dig into the details. The versions of the rules are all available on our website for free. And as a next step, we encourage you to respond to the National Committee on Vital and Health Statistics request for comment on the value of the proposed operating rules. I would note here that NCVHS is also reviewing some proposed standard updates for the X12 standard. So that is another area of interest for you. We encourage you to respond on that topic as well. Comment letters are due to NCVHS on Thursday, December 15th to the email address you see on the slide here. CORE has developed a number of resources to support comment letter development in addition to this webinar. We have a dedicated website that is linked on this slide that includes all kinds of information to help you develop comments, including links to all of the operating rules, the NCVHS recommendation letter from the CORE board that includes their rationale on why they decided to move these rules forward for federal mandate. We've developed a bit of a cheat sheet that compares the requirements in the currently mandated operating rules to the updated versions of the operating rules and outline the benefits to industry for moving to those new requirements and also the new operating rule benefits as well. We have an RFC guidance document that you can use as a reference to help you think about how to respond to the request for comment. We have lists of all the webinars we've given over the past couple years on the proposed operating rules. And we will soon have a toolkit to help you evaluate the cost benefits of operating rule implementation at your organization. Please let us know if there are other tools that would be helpful for your organization to support comment letter development. Our staff is here to help, so you can reach us directly at the email address on the screen. Thank you so much for spending your time with us, and please reach out if you have any questions. Have a great day.